I am Shivani, working as a nursing tutor at Khalsa College of Nursing, Amritsar. Today I am here before you discuss the topic botulism. One of the most foodborne illnesses, botulism is one of the most dangerous. It can paralyze you and can be life-threatening. Now what is botulism? Botulism is a serious condition but rare that attacks your body nerves. It is caused by Clostridium botulinum. It releases neurotoxin, which is a poison that attacks your body's nervous system. Now, what is the morphology of Clostridium botulinum? It is an anaerobic, gram-positive, spore-forming motile rods which are of size 0.9 to 1.2 micrometer with oval and subterminal spores. It usually found in soil and marine environment in the intestine of herbivores and fish throughout the world. Now toxins. The bacteria produces 7 types of toxins, that is A to G, in which A, B, E and F causes illness in the mammals, fishes and birds. C, D and E toxins causes illness in mammals, fishes and birds. Modes of transmission. The bacteria does not transfer from person to person. It occurs by consuming the spores or toxins of the bacteria. Now what are the causes of the botulism? Like home canned food, unrefrigerated foods, homemade salsa or syrup, traditionally prepared or fermented fish, or other factors like low level of oxygen, without oxygen, low cooking temperature, warm storage temperature, low acid content or low pH, and low sugar and salt content. Now what are the types of botulism? There are 3 types of botulism, that is foodborne botulism, wound botulism and infant botulism. Now foodborne botulism occurs by consuming the bacterial toxins in the food. Wound botulism occurs when an organism enters an open wound and it will release the neurotoxin, that is a poison, and it will attack your nerves and lead to cause paralysis. Infant botulism occurs when an infant consumes the food and get spores in their food and which ultimately grow in their gut and lead to cause infant botulism. Now pathogenesis, how the bacteria causes botulism. Toxin release in the blood through mucosal surface or wound bind to the peripheral cholinergic nerve endings, then inhibit the release of acetylcholine and prevent muscles from contraction, lead to further cause descending paralysis and which begin from the cranial nerves and progressing downwards, then further lead to cause obstruction of respiratory muscles and respiratory paralysis, then further lead to cause severe complications like intensive prolonged ventilation and intensive cares. Now sign and symptoms. First, sign and symptom in adults who are suffering from the infant botulism: drooling, drooping, dizziness, irritability, difficulty in swallowing, tiredness, weak cry and floppiness. General symptoms in the adult: dizziness, nausea, vomiting, constipation, slow facial expression, paralysis, then difficulty in swallowing. Now how to rule out this disease condition? First of all, doctor should do physical examination, then he will collect the samples like serum or toxin, because the toxins are available in the serums. And stool sample should collect, like gastric aspiration is done from the last 5 to 7 days. Then electromyography to rule out the disease condition, then brain scan, MRI is done to rule out other symptoms like stroke, and CSF examination. At last, treatment. The doctor should prescribe treatment like antibiotics to prevent further complication, antitoxins like sportive care, and intravenous feedings. At last, prevention and control. Always avoid home canning. If you are doing home canning at homes, use pressure canners. Avoid contamination of food. Always cover the food and do storage of food at proper temperature, and avoid homemade syrups or honeys giving to the baby. Treatment of botulism. Antitoxin. Antitoxin is the main treatment of the botulism. It interferes with the bloodstream and can help you to get worse your symptoms. Then next is the antibiotics. Antibiotics are not the treatment of the botulism, but in case of wound botulism, it can treat you. Now, what is the treatment of botulism in infants? Doctors treat infant botulism with an antitoxin called botulism immunoglobulins. They give to the babies as soon as they get suspected The disease condition is botulism. Babies with botulism who get antitoxin BIG/IV like botulism immunoglobulins, they get recover earlier. They spend short time in the hospitals. Now, a couple of things to remember to prevent botulism. Store oils infused with herbs or garlics in refrigerator. Avoid non-pasteurized honey for babies less than 1 year. Boiling for food at least for 5 minutes to kill the or destroy the toxins of bacteria. Do not give honey or corn syrup to the babies who are younger than 1 year old. If you are addicted to the heroin, never share your needles and don't use black tars. Always follow guides for home canning like pressure canners and rigorously follow the guides of home canning. So, botulism is a serious but rare condition that attacks your nerves system. It is caused by few types of bacterium, that is Clostridium botulinum, which will attack your nerve system. Muscles become weak and becoming paralyzed. The spores from the bacteria can be breathed in, can get into open wound, injected or taken in from certain food sources. Taking extra care when preparing, canning, preserving food at home can prevent botulism. Always keep honey out of your child's diet to prevent infant botulism until they turn 1 year old. Immediate treatment is important for the effective treatment, so always do home canning but use pressure canner for the home canning. So this is the treatment of the or preventions of the botulism, that how you can prevent from the botulism. It is a rare but a most dangerous disease condition that can lead to, if it is not treated well, it can lead to fatal illness and ultimately death of the person. Thank you.